My name is Dr. Donald Finnerty. I am a urologist. I've been in practice here at the clinic in Noonan, Georgia for approximately 10 years. I was exposed to medicine at a very early age. When I was 6 or 7, I used to make rounds with my dad, go from hospital to hospital and listen to him talk to patients, talk to their families, and I emulated him in every way. I was proud of him, and I certainly wanted to be very much like him. And so I decided at the age of 7 that that's what I wanted to be. I didn't want to be a fireman or a policeman. I wanted to be a physician. And so that really guided my life as far as my education and my pursuit of that profession. I moved to Atlanta in the late 70s to go to Emory University, where I trained in urology. I stayed on the faculty at Emory, where I was chief of urology at Grady Hospital, and then I've been in private practice since that time. Some of the problems we commonly see in men are diseases of the prostate. That includes enlargement of the prostate, it includes cancer of the prostate, it includes inflammatory processes or infections of the prostate. And these affect men young and old. The trend in medicine today, and in urology also, that less is better. And so what we do is we offer people some minimally invasive treatment of prostatic enlargement. These are men usually who have tried medication and this has failed, and now are opting for something less than open surgical intervention for their prostate problem. We have a procedure in the office known as TUNA, which is transurethral needle ablation of the prostate. Over time, the prostate shrinks and the channel enlarges and the urinary stream improves. And this does a great deal towards improving men's quality of life. Many of these men are able to get off of all their medications, their stream improves, and in general, their quality of their life is better. I think that in my 30 years in urology, the most significant advance in terms of urinary health in men is the advent of the PSA. It has revolutionized the diagnosis and treatment of this problem, and it has significantly decreased the death rate in this country from prostate cancer. It should be done on an annual basis. I see men with the problem of erectile dysfunction, which is the difficulty of either achieving or maintaining an erection. Sometimes it's an embarrassing problem that is difficult for patients to talk about. We do have many options for treating this problem today, which include medications as well as other non-invasive and some surgical procedures to correct the problem. In women, we treat also some urinary cancers. We also treat female urinary incontinence, which is a very common problem in young women and older women for different reasons. And so we are expert at diagnosing the problem as far as the cause of the problem, and treatments can vary anywhere from medications to surgical intervention. I also have patients that see me from all around the state of Georgia that originally saw me in Atlanta when I was affiliated with Emory. And again, every time I see them, I tell them that I'm honored and flattered, and I thank them for seeking me out in my care. I am Dr. Donald Finnerty, and I am PAPP Clinic.